my name's Bridget. Oil, here's my name, Bridget. And everything written on it. All good though. Hi, how are you?
I'm good.
Good. My name is Bridget. I'm going to be your student nurse today.
Okay.
I'm going to be doing a head-to-toe assessment on you. Can you tell me your first and last name?
Julia Koselniak,
Okay, Julia, what's your birthday?
5/13/03.
Amazing. And Julia, are you allergic to anything?
Nope.
Okay. Do you know what city we're in?
Saginaw.
All right. And who's the president?
Joe Biden.
All right. And what year is it?
2023.
Okay. I'm just going to be asking you a couple questions before I get started. Do you take any medications?
Nope.
No? Any over-the-counter supplements, herbals, anything?
Sometimes ibuprofen when I have a headache.
Okay. Do you have any past medical diagnoses? Any surgical history? Okay. And do you drink, smoke, or do drugs?
I do not.
You don't? Awesome. Okay. So now that all looks good, I'm going to take your vitals before I get going. Do you have an arm preference for your blood pressure?
No.
I'm going to do it on this one right here.
Okay.
Can you flip your arm for me? Thank you. Awesome. I got 118/76. Is that okay for you? Awesome. I'm going to be getting your heart rate. Stick out your arm for me. Awesome. Okay, for your heart rate, I got 75, and for your respirations, I got 18, which I think looks good there. I do not have a pulse oximeter, so I'm just going to check your cap reflow. Stick out your hands for me. Good. Come back in 3 seconds, or just less than 3 seconds, which is what we want to see. And do you feel like you have a temperature today, a fever at all? No. I'm just going to feel you. You don't feel warm, so I'd expect your temperature to be around 98.6. Okay, so everything looks good with your vitals. Are you in any pain today?
No.
Awesome. So have you ever had a head to toe before?
No.
Awesome. So what I'm going to be doing is I'm literally going to be assessing you from your head to your toe. If you feel any pain or have any questions the whole time, just let me know. Okay? I'm going to be starting with your arms. So I'm going to put my hands on your shoulders and then you just do one motion of swimming and then one forward and then backwards. And I'm going to feel your shoulders here. Awesome. A little cracking. Is that normal for you?
Mm-hmm.
Okay. I'm going to have you stick your hands out like this and then push on mine. Push on yours and then flip your hands up. Push up. All right. And push down. Amazing. Can you stick your arms out for me? I'm going to feel your pulses. Alright, your radial is symmetrical and strong. There we go. There's your radial, and they're also symmetrical and strong. Awesome, everything looks good there. Muscle tone looks good. No moles, temperature looks good. I see no problems there. Awesome. So now I'm going to be moving on to your head. So I'm going to have you look down for me. I'm just going to feel your hair. Have you ever dyed your hair before?
No.
Awesome. Your head feels good. Are you feeling your occipital lymph node? Any pain back there?
No.
Awesome. So be non-tender and non-palpable. Okay, so now I'm going to be starting with your eyes. You wear contacts?
Yeah.
Okay, no problems with that?
Nope.
Okay. So I don't see any drainage. I'm going to have you look up for me. Alright, sclera is white and conjunctiva is pink. Everything looks normal there, no drainage. And now I'm going to be looking in your eye. Go ahead and look at me and at my pen light. Awesome. Keep looking at me. Everything looks good there. I'm going to have you follow my pen light. Good there. Okay, now I'm going to put my pen light right here and then have you look at my pen light. Look at my hand. Pen light, hand. Okay. And then pen light, hand. Pen light, hand. Awesome. Everything looks good there. Your pupils are equal, round, reactive to light, and light accommodating. Everything looks good. Alright, now I'm going to be moving on to your ears here. I see you have some piercings. Do you have any issues with those?
Nope.
Awesome. Palpating your pinna. No problems there, no pain?
Mm-hmm.
Okay. I don't have an otoscope, so I'm just going to be looking in your ears with my pen light. Awesome. I don't see any drainage, no redness. Everything looks good there. Alright, now I'm going to be moving on to your nose. I see you have a piercing there. Do you have any problems with that?
No.
Awesome. And have you ever broken your nose? No. No. Okay, I'm going to have you look up. I'm just going to be looking at your nose. There's no deviations, no polyps, nothing like that, and it looks moist just the way we like it. Okay. Next, I'm going to be, and when I did your eyes, I checked cranial nerve 3, 4, and 6. When I did your eyes with the snowflake and then the light accompaniment stuff, okay? All right, now I'm going to have you close your eyes. I'm going to have you smell something and tell me what it is.
Cinnamon.
Cinnamon, okay, awesome. And that's cranial nerve number 1. Okay, now I'm going to be moving on to your mouth. Have you ever had any cavities?
Yeah.
Okay, but you see the dentist regularly?
Yeah.
Awesome. And did you have braces as a kid? All right. So I'm going to be looking at your, can you just smile for me? Awesome, everything looks good there. And when you stick out your tongue and say, ah. Awesome, will you lift up your tongue for me? Right, side to side, everything looks good there. All right, will you stick your tongue back out at me and move side to side and up and down? Awesome, so that was checking cranial nerve 9, 10, and 12. All right. Now I'm moving on to your face here. Just feeling your sinuses. Any pressure or pain?
No.
No? Okay. Feels good to me. And now I'm going to be testing your sensations. I'm going to close your eyes. I'm going to touch 5 different spots on your face and just tell me where I'm touching you, okay?
Forehead.
Okay.
Nose. Left cheek. Right cheek. Chin.
Amazing. And then will you puff your cheeks out for me? Smile, frown, and then raise your eyebrows. Awesome. And that's checking cranial nerve 5 and 7. And so now I'm going to be checking your lymph nodes. Come back here. And feel your postauricular, preauricular, submandibular, submental, cervical chain. I'm going to pull your gown down. Is that okay?
Mm-hmm.
Okay. And when you scrunch your shoulders for me, I'm going to feel your supraclavicular. Everything looks good there. And while you're there, I'm going to check your skin trigger. Awesome. And when you raise your shoulders like that, that was cranial nerve number 11. So everything looks good there. And so now I'm going to put my pins right here and you clench your jaw. And then when you swallow, no pain, anything like that. Awesome. Everything looks symmetrical and everything looks good there. Okay. checking really quick before we move on. Awesome. Okay, so one last thing before I ask you to turn around, I'm going to do your carotid. Good. Amazing. So I'm going to listen with my bell for any breathes. And when I do that, I'm just going to have you hold your breath for me, okay? Okay, hold your breath. Awesome. Go ahead and take the breath. Alright, hold. Awesome. Everything looks good there. I did not hear any breathe. So I'm going to have you turn around for me. Alright, so I'm just inspecting your back here. Everything looks good. I don't see any moles or anything that I need to be worried about. Spine looks good. Alright, I'm going to put my hands on your back and just have you take a deep breath for me, okay? Awesome. And when you did that, my hands expanded symmetrically, so that's what we want to hear. So now I'm going to be moving on to percussing your lungs here. So I'm going to put 2 fingers on and I'm going to be tapping motion. If you feel any pain, let me know, okay? I'm going to do 12 different spots. Okay. Awesome. And I heard resonance there, which is what we want to hear. So now I'm going to be doing the same thing, except for I'm going to be listening with my stethoscope. And every time I move my diaphragm, I'm just going to take a deep breath for me, okay? Moving to my diaphragm. Are you doing okay?
Yep.
Okay, I'm going to continue. I'm going to lift this up, okay? And last one. Awesome. Your lungs sound clear, which is everything we want to hear. Did you feel any pain with that?
No.
Are you feeling okay after all that breathing?
Yep.
Awesome. Okay, so now I'm going to be feeling your thyroid and your trachea here. This might feel a little awkward. I'm going to be coming around here and then move to one side, feel, and then move to the other side and feel. Okay?
Okay.
Any pain with that?
No.
Awesome. So that was everything we needed to feel. No non-tender and non-palpable. So everything looks good there, and I did not feel anything else at all. Okay. So now I'm going to be moving on to you laying down for me. Awesome. Okay. So before we do that, I'm going to move this pillow from you. I'm going to have you look over there. Alright. I'm going to do it on that side. I'm going to look this side. No JVD there either. Here's your pillow back. Alright, I'm going to start by listening to your chest here. So I'm going to listen to 5 different spots. If you can pull that down. Awesome. I'm inspecting the chest. I don't see anything I need to be worried about. Temperature looks good. Okay. So I'm going to listen to 5 different spots, and at each spot I'm going to be listening with my diaphragm and then switch it to my bell. Let me know if you have any questions, okay? You can just breathe normally. Clavicle. Here's rib 1. Here's rib 2. Alright, I'm listening to the aortic with my diaphragm in intercostal space 2. Okay. Switching to my bell. Okay. Come over on your left side. Here's rib 1. There's rib 2. So I'm listening to pulmonic with my diaphragm. Switch into my bell. Good. 1 down. Intercostal space 3. For herbs. My bell. Intercostal space 4. Listening to tricuspid with my diaphragm. Switch into the bell. Alright, I'm going to go to intercostal space 5, and I'm going to leave my finger there. If you can lift up your breath for me. Okay, found my finger. Sorry. I'm going to go mid-clavicular with my diaphragm. And this is your mitral. I'm listening to my diaphragm. My bell. All right, now I'm going to be listening at this spot for a minute, okay? Awesome. Okay, I got 74 for that, so it matches with the beginning. Awesome. And now I'm going to move you onto your abdomen here. So I'm going to have you pull down that. Perfect. Before I do anything, I'm just inspecting. Everything looks good there. And I'm going to come to the edge of the bed. Everything looks symmetrical. And I can see your abdominal aorta pulsating. So before I do, I'm going to start listening, and your stomach is divided into 4 quadrants. So I'm going to be listening to about 4 to 5 vowel sounds in each quadrant, okay? You can just breathe normally for me. I'm listening with my diaphragm. Awesome, and I did hear 4 to 5 vowel sounds in each quadrant. All right, now I'm going to be listening to the arteries in your stomach, okay? With my bell. And this one in the middle here. Abdominal aorta. Left renal, right renal, right iliac, and left iliac. Awesome, I did not hear any breweries, and your bowel is very active. When I listened to your heart, I heard love dove at each spot, and I did not hear any murmurs. So everything was good, both listening to both spots there. So now I'm going to be doing the same kind of tapping motion I did on your back, except for I'm going to be doing it on your stomach, okay? And I didn't hear anything, so I feel safe to continue with the tapping, okay? So I'm going to do 3 spots in each quadrant. Let me know if you feel any pain, okay? Awesome. I heard tympani in your bowel, so now I'm going to be progressing up to find your liver. Okay? I'm just put my fingers down here for a minute. All right. And there it is, right there, right below your rib. Okay. And I didn't feel anything like that. Everything sounds good, so now I'm going to be moving on to some light palpation. Okay? So let me know if you have any pain. Doing okay?
Mm-hmm.
All right, now I'm going to do a little deeper, okay?
Mm-hmm.
No pain there?
No.
Awesome. I didn't feel anything else either, so everything looks good there. So now I'm going to be doing your femoral arteries. So these are like right on your hip line. So I'm going to find that I'm going to have you lift your legs up. All right, and I'm just going to stick my hands underneath here, okay?
Mm-hmm.
They're symmetrical and strong. For this one, my finger's right here. For this one, my finger is right here. Everything looks good there. So now I'm going to listen to each of them. Find it again really quick. Here's my bell. Just gonna stick this in. Sounds good there. I'm gonna find it again over here. Just awesome. And I did not hear any breweries there. Everything sounds good. All right, now I'm gonna move on to your legs here. Just inspecting your legs. Temperature looks good. Muscle tone looks good. Amazing. I'm gonna feel your pulses in your legs, okay? Start with your popliteal. Awesome, symmetrical and strong. I'm gonna come down here. Tibialis. Feel symmetrical there. And I'm gonna feel your dorsalis pedis. Everything feels symmetrical and strong there as well. So now I'm going to do a sensation test on you. Okay? So I'm going to have you close your eyes, and then this is going to be sharp, and this is going to be dull. Okay? And you just tell me where it is and if it's sharp or dull. Okay? Awesome. Everything right there. I'm just going to be inspecting your toes. Everything looks good there. Your feet look good. Let me see if you can move back. This really quick. All right. So now I'm going to have you swing to the edge of the bed here, but don't stand up yet. Okay. Amazing. I'm checking your leg muscle again. Everything looks good here. All right, and I'm going to have you push down on my feet, on my hands, I mean. Awesome. Pull up. Good. Now, I do see you have your toes painted, so I'm going to check your calf reflow underneath. Good there. Awesome. Good there. And then will you come a little closer so that you can dangle your legs? Awesome. So I'm going to be checking your patellar reflex. Awesome. You doing okay?
Mm-hmm.
Good. All right. So before I stand you up, I'm going to do your cerebellar function, okay?
Mm-hmm.
So with my pen light, I'm going to have you touch my pen light, touch your nose, pen light, nose, pen light, nose. Awesome. And then you make a okay sign with me, and then go all the way down as fast as you can. Awesome. And then hands on the thigh, and then flip. Good. So based on everything in the head to toe, I feel that you are safe to walk with me. So I'm going to do your Romberg test, but before we do that, I'm going to make sure you have your shoes on. Mm-hmm. Everything all good there?
Mm-hmm.
Okay, so you go ahead and stand up. Are you feeling okay?
Mm-hmm.
Okay, so this is going to be the Romberg test. I'm testing KO number 8, okay? So I'm going to have you stand about shoulder width apart with your hands onto your side, and then just stay there with your eyes closed, okay? Awesome, so you didn't have no swing, so I'd give you a negative on the Romberg, which is what we want to see. So one of the last things I'm going to have you do is I'm going to have you walk to my stove and then walk back, okay? You can just walk normally. Alright, and then you can go heel toe walk for me. Awesome. Are you feeling okay?
Yeah.
Awesome. So that is the end of my head to toe. I'd give you a braiding scale of 23 because I don't see any problems with your movement or your moisture or anything like that. Friction and shear, nothing along those lines. Sensation looked good, everything looked good to me. So overall your head to toe is normal and I see no issues with that. Good.
Hi, my name is Jenny. I'll be your nurse today. I have gathered my supplies, washed my hands, provided privacy. I'll apply gloves as needed. We're going to be doing a physical assessment today. Can you please tell me your first and last name and date of birth?
Caitlin Linda, January 6, 2000.
Thank you. Do you have any past or current health problems related to the area of assessment today? Is it a heart murmur or tingling in your extremities?
No.
Alright, perfect. I'm going to listen to your heart sounds. I'm going to start with the aortic, which is your second intercostal space on your right side sternal border. We'll listen to your pulmonic, which is your second intercostal space, but on the left side, still on the sternal border. Okay. Now I'm going to listen to Erb's point, which is your third intercostal space on the left side in the sternal border. Okay. Now I'm going to go up to the bottom, so can you hold your shorts bra? Thank you. I'm going to listen to the tricuspid, which is the fourth intercostal space on the left side in the sternal border still. Okay, now I'm going to listen to your mitral, which is the apex of your heart. It's in the fifth intercostal space, but this one is mid-clavicular. And your heart rate is strong and regular, so I'm going to count for 30 seconds and multiply that number by 2. Alright, so I got 42, so I multiply that by 2, which is 84, and that's normal, so within the normal range of 60 to 100. I heard the S1 and S2. I didn't hear any heart murmurs, which is good. Your heart rate was elastic, normal, regular. I would rate it a +2. It was strong. So that's good. Can you please put out your arms for me? Thank you. Her arms are symmetrical in length. There is no color variations. They're the same color. I'm going to palpate. There is no edema or inflammation. She has a few pinpoint primary lesions, freckles, on the anterior side of both arms. So bilaterally, she has a birthmark on her left arm on the anterior side. Can you please squeeze my hands for me? Thank you. Her strength was bilaterally equal. Both arms were equal. Can you please put your legs up on the bed? Thank you. Her legs are tan with no color variations on the anterior or posterior sides. They are bilaterally shaved, and the hair follicles are evenly distributed anteriorly and posteriorly. She has no prominent venous patterning. She has a few pinpoint flat lesions on the anterior side of both legs. Again, they are not raised. There's no redness around them. There's a few. She has a secondary scar right here on her left leg on the anterior side, and a birthmark right here, which is primary. And then on the posterior side, I don't see any lesions. She has another primary lesion freckle that's flat, and then a birthmark posterior on her left leg. That looks about good. I don't see any vascular lesions. I'm going to palpate for edema. I don't feel any edema or inflammation in her legs or her feet. There's no lesions between her toes. There is a primary lesion on her foot right there. It's a freckle. It is flat and pinpoint. There's no ulcerations on the anterior or posterior sides of her legs. So now I'm going to palpate her posterior tibialis. Her heart rate is strong. I'd rate it a +2. I'm going to do her dorsalis pedis, which again is strong and a +2. Did you have any tingling or numbness in any of your extremities? No. Perfect. So now I would place my patient in BIC, so in a comfortable position, items within reach, call it within reach, safe environment, side rails up ×2, and document my findings.